back to the channel. Today, we are going to talk about something really important that affects millions of people around the world called diabetes. So, what is diabetes? Diabetes is a health condition where your body has a trouble managing blood sugar levels. So, what is the blood sugar levels? Is the amount of glucose in your blood. Glucose is the body's main source of energy. We get it from the food, especially carbs. Normally what happens, our body uses a hormone called insulin, which is made in the pancreas, to help glucose move from the blood into the cells. So what actually happens? Insulin helps glucose move from the blood into the cells. But in the diabetes, either your body does not make enough insulin or it cannot use properly. So sugar builds up in the blood instead of going to the cells. And that causes a serious problem like high blood sugar, also called hyperglycemia. So how blood sugar works? Let's quickly understand what happens in the body. The pancreas is the organ behind the stomach. It makes insulin. When you eat a food, especially carbs, it turns into the glucose. Insulin acts like a key. It unlocks the cells, lets the glucose enter, so you get energy. So what actually happened? Insulin acts like a key and it unlocks the cell so the glucose could enter and you could get the energy. But in the diabetes, either the body does not produce insulin, type 1, or body cannot use the insulin properly, type 2. Just keep in mind, in the type 1, what happened? Body does not produce insulin, but in the type 2, body produce insulin, but body resists it. Body cannot use insulin properly. As a result, sugar stays in the blood and causes problems. Okay, let's talk about key differences in both types. Type 1. It is usually starts in childhood and early adulthood. It is autoimmune condition. The body attacks its own insulin producing cells. So what happens? No insulin is made at all. People need to take insulin injections for life. Type 2 diabetes. This is the more common type. Usually happens in adults but can also occur in young people due to poor lifestyle. In this type, the body still makes insulin but doesn't work properly. It's called insulin resistance, and it also linked to the poor diet, lack of exercise, obesity, and genetic. Okay, so let's quickly discuss about the causes and risk factors about both types. Type 1, we don't know the exact cause, but it is related to genetics and immune system issues. Keep in mind, type 1 is not caused by diet or lifestyle. However, type 2 is directly related to being overweight, lack of physical exercise, poor diet, too much sugar or junk food, high blood pressure or cholesterol, or gestational diabetes during pregnancy and more. Okay, so what are the signs and symptoms of both types? There are 3 hallmark signs you have to keep in mind. They are polydipsia, polyphagia, polyuria. So what is polydipsia? Polydipsia means excessive thirst. Polyuria means frequent urination, and polyphagia means excessive hunger. If you experience these 3 symptoms together, go to the doctor straight away to check your sugar levels. Okay, so let's talk about the diagnosis. How can we diagnose both types? What kind of tests we have to do? First is fasting blood sugar. We do this after not eating overnight. Keep in mind, a person needs to stay empty stomach overnight to do this test. Number 2, hemoglobin A1C test. This test shows average blood sugar for past 2 to 3 months. Third is oral glucose tolerance test. This is done mostly in pregnant women. Okay, so let's talk about treatment and medication options. For type 1, insulin injections or pumps are available to keep sugar levels normal in range. And a person needs to monitoring blood sugar level regularly because it's very important in type 1 to check your sugar level frequently or on the daily basis. For type 2, first step is very important is lifestyle changes including diet modifications, daily exercise or weight loss. Medications like metformin reduce glucose production. What it do? Reducing the glucose production in the body. And the second is sulfonylureas helps body release more insulin. Other inhibitors or agonists like DPP4, GLP-1, SGLT2 inhibitors are options always available in the market, but keep in mind always take medication as prescribed by your doctors and after checking your sugar levels.